Welcome to the Lyster Health Talks podcast. Listen in as the team focuses on relevant, relatable health content that empowers your health and the readiness of the force. We are officially clearing the runway for a special mini-series dedicated entirely to aviation medicine. We're diving into the critical role aviation medicine plays in keeping our pilots and crews mission ready and showing you exactly how our care keeps you in the air. Let's prep for takeoff as we talk aviation medicine here at Fort Rucker, the home of Army Aviation.
Welcome to the Aviation Medicine mini-series. I'm Lieutenant Colonel Leah Steder, the Director and Commander of Lyster Army Health Clinic and the host of the Lyster Health Talks podcast. For 7 episodes, we've explored the science, the medicine, the myths, the regulations, and the incredible people behind Army Aviation Medicine. But today, we're ending where every mission truly begins, with trust. A pilot trusting a medical team, a nurse caring for an aviator before, during, and after the mission. 2 professionals with different jobs, one shared purpose, keeping America's Army aviators in the fight. Welcome to the final episode of our aviation medical series. I am joined today by 2 of our very own, our Deputy Commander of Nursing, Lieutenant Colonel Rebecca Mercer.
Hi, thanks for having me.
And our very own company commander and resident Medevac pilot, Captain Christian Sprinkle.
Thank you for having me, ma'am.
Thank you both for joining us on our last episode of this aviation mini-series. So let's try fact or fiction. Pilots always know where they're going.
Fact.
Nurses know everything before the doctor does.
Fact.
Coffee should be listed as medical equipment.
Fact.
Everyone always wishes they are flying.
Fact.
Christian, will you tell our listeners about your very first flight?
Wow. Let me reach into the Wayback Machine. My very first flight was just prior to Christmas in 2017. I had my nickel ride in a UH-72. My instructor pilot was a Mr. Paul Madrid, and he took us up to about 3,000 or 4,000 feet in the air. He said, "You have the controls, practice ascending, descending," and that's kind of it. Your first taste is just a very brief adventure before you get to come back and start the hard work of actually learning how to maneuver the aircraft.
Will you talk a little bit about what drew you to Army Aviation?
Yes, ma'am. So my father was a pilot in the Air Force. He flew RF-4 Phantoms. He said that I would make him proud if I joined the Air Force, and like the good son I am, I joined the Army instead.
Up until now, you've spent the bulk of your career with Army Aviation and not Army Medicine. So you have a unique viewpoint from both a pilot point of view and a medical point of view about how important it is for Army aviators to trust Army Medicine.
Yes, ma'am. It's the foundation of what aviation is built off of.
And then can you explain, in your opinion, why trust between aviators and the medical team is so important?
Yeah, absolutely. So right from the get-go, before you ever set foot in an aircraft, you're going to be poked, prodded, evaluated by a flight physician who's going to assess that you're physically, biologically, I guess, capable of the rigors of flying. And so when you do get the chance to get in that aircraft or behind the controls of a helicopter, is that everything else has been approved and they are ready to assume the task of learning how to fly.
When you think about everything we've covered throughout the series, what do you wish more people understood about the teamwork behind Army Aviation and Army Medicine?
Yeah, having made transition over into the clinical side of things, I would just say that when you're in an active role in an aviation brigade or some other like frontline type unit, it's very easy for you to think critically about what support you are failing to get and not understand everything that goes into that support apparatus that exists behind you. So, why is my flight physical not up? Why do they need me to fill out a PHA? Why do they need me to do all this when I'm capable? I just need the support apparatus to recognize that. And you don't really get to appreciate it before you step behind the curtain and see just the enormous amount of time and effort that has to go into each individual aviator, each individual patient to make those things happen on the other end of it.
So when I think of teamwork behind AMED, Army Medicine, and Army Aviation, as a nurse, let me go ahead and get this out of the way. Any good paratrooper would make sure to say that they were a paratrooper at one point. And so as a paratrooper, I used to jump out of these helicopters, aircrafts, be in a force comm unit, with the Charlie Med and the Roll 2, the teamwork that's needed when you're talking about patient evac, right from those forward-ish units. Also worked in a FRSD too, so that teamwork and communication is really important when you're trying to coordinate evac and having the patients packaged up and ready to go, not having, if you're in a hot zone, a hot area, that bird needs to come in, get out as quick as possible and get your patients out. So you're running to coordinate the timing and not have them sitting there waiting. So that is a lot of teamwork. But I would be remiss if I forgot to mention that I was a paratrooper, and I just used to jump out of UH-60s.
The second most impressive job title that starts with a P.
Okay.
Fort Rucker has a significant amount of medical personnel, not just Lyster. There's 5 other medical units. It's not an accident that aviation is co-located with medicine. And you'll see in a lot of units, whether it's the 82nd Airborne with the paratroopers or in any random deployments, generally speaking, in any talk, you always see the Meadow sitting right next to the aviation battle captain. So we're paired together because it is very important that medicine and aviation are nested together. Becca, will you please tell us a little bit about your experience with Army Aviation and Army Medicine?
Sure, yeah. So I guess it was when I was a brigade nurse for 2nd Brigade, 82nd Airborne, and I was the 2nd Brigade nurse with them. And so the Charlie Med, the Roll 2, going out and doing all the FTXs and the trainings, and Medevac training. So that was the first experience that I had, doing the hot and cold load training with them. So yeah, we learned a lot about, the communication and, again, teamwork between the Army nurses and Army Aviation.
That's all excellent. One of the unique things that you guys as Army nurses have that is very unique to your corps for officers is that you actually get the chance to be in the back of a bird treating patients. Can you tell us a little bit about that path and what that looks like?
You have the Joint En Route Critical Care course, which is here at Fort Rucker. And so you need to be a 66 Sierra, an ICU nurse, or a 66 Tango, an ER nurse first, and have experience there. And then you have to go get a flight physical, get all of that done. You can go to the course and learning, how altitude and ventilators and drips, there's so much to it, but that is a really critical position that the Army has, and we're very short and few on. That is something that, and actually right now they have changed it to where you get an identifier. It's a Mike 5 identifier if you actually complete the course and are a position. There's also flight burn nursing too. That's another option.
Those are excellent points, and I know that the en route critical care nurse is relatively new in the grand scheme of Army medicine. I think it came about because of the significant length of patient transfers in Afghanistan with ventilated patients ultimately. Mm-hmm.
Captain Sprinkle, as a pilot, what are your views on having a ECCN in the back of your bird?
Well, thank you for asking. I think it's a dramatic improvement over the care capabilities that we would provide in our current setup, which is a one flight paramedic and one crew chief who has kind of been side trained to identify, here's a bandage, here's how you spike an IV bag. So to have a team of medical professionals in the back providing that care to the patient who are both communicating in a language that they understand, I can't imagine a world where that doesn't result in better outcomes for the patient, which Absolutely. At the end of the day is what we are all about.
Drastically improves those. 2 highly trained medical professionals. Yeah, because you have your ICU or ER nurse that's not just a brand new one, and your flight medics, they're highly trained and know what they're doing, so that's really, really good.
This is a question to both of you, because arguably you both have incredibly stressful jobs at times where every decision you make or lead your teams through does have life or death consequences, but how do you stay calm when everyone around you is looking to you for answers?
Everything that you experience, be it in a helicopter, in a operations cell, has been experienced before. So if you do the due diligence of researching, reading, studying, then you can pretty adequately prepare yourself, not necessarily to succeed at every stressful environment or dangerous situation that you get into, but to give yourself the biggest chance at meeting it successfully. In aviation, we've introduced FRC cards, which are the new emergency response methodology, and that drills into you the proper actions to take and referencing a physical card. And so you will react to a situation the way that you prepare for it. So if you prepare for that situation, you will react accordingly.
Yeah, true. That's, I'd say, like you said, the training, the exposure. As a nurse, I was pretty scared thinking about being an ICU nurse, and there's so much to it, and there is. But going through the course and then all the training, and I mean, really, it just comes down to ABCs, airway, breathing, circulation, like stop the bleed, make sure there's an airway. Once you get those, everything else, and then just knowing who your team is around you and being able to delegate and knowing that hopefully you have been a part of training that team. And so everybody is also prepared for what they're supposed to do, whether it's your respiratory therapist, your medics, your ER providers, the nurses, x-ray, like the more you train together, you're a well-oiled machine and everybody just knows what they're supposed to do. And yeah, you just kind of execute. You just work together as a team.
So this is our 8th episode of our Aviation Mini-Series podcast. You both have incredibly hard and stressful jobs, and both of your professions, from a readiness standpoint, are incredibly important. We focused a lot on the importance for aviators to stay healthy and get medical care when needed. And Christian, you've been in for about 10 years, 8 to 10 years, correct?
About 10 years, ma'am, yes.
What's one health habit, and I think this is important as well for Army medicine as well, but what's one health habit every aviator should prioritize?
I would say for a health habit, just doing something every day, whether it's cardiovascular or strength resistance training, just overcome that mental hurdle and get your body active doing something will prepare you for sitting in the same spot, a stress response that your body is giving you, and it helps you breathe. And if you can breathe, then you can continue thinking, and if you can continue thinking, then you can continue to make sound decisions under stressful situations. Yeah, so the key is just not being sedentary. And as you get active and move your body every day, you have to listen to it as well. So if you feel those aches, pains, tweaks, coming on as you get older, then you need to seek out the excellent professional help. Here at Lyster, we have excellent physicians, excellent nurses, excellent physical therapists who are all here to make sure that the soldier, service member, aviator gets back up into the air as soon as possible. So just get rid of that stigma and get the help you need, and you can get those flight hours.
One area you just mentioned, we haven't done a lot on this podcast, but have on previous podcasts talked about physical therapy. And your profession, you guys have one of the heaviest helmets, and the vibration of the aircraft does add additional stress that not everyone is used to. So prevention is a big topic. One of our previous physical therapists worked with some of the USRL team and exercise physiologists to develop a spinal resiliency program that is specifically geared towards prevention of injuries for Army aviators. And that's gotten a lot of traction.
A lot of the exercises that I've found most successful have been taken from the physical therapists here at Rucker to help alleviate or mitigate or prevent those injuries that come from excess helmet weight, vibrations, and things like that.
Becca, nursing is very similar to aviation. You guys work long hours. I know prevention is equally as important for nursing, but can you also talk about what's an additional habit or?
The one thing that I would say that nurses need to be aware of or to be doing is back protection. The movement of patients, good posture, lifting with your knees. It's a silly thing, but it's not a silly thing. We hear it all the time, but it is so important. 17 years now, and it's all catching up. And I'm sure it was some bad body mechanics of moving patients, moving heavy equipment. I mean, you're moving patients from a gurney to a bed, from a bed to an MRI machine to, the helicopter. So back protection is so important. Core strength is important as well to help protect your spine. So that's the biggest thing I would tell nurses. We hear it all the time, but I promise it is literally the number one thing I would tell all nurses to be aware of and think about from the very beginning.
Thank you. That's excellent. I think throughout this mini-series, we've really talked about the importance of prevention. As we wrap up today, I'm just going to ask you guys for your final thoughts, because what you both do is important. So, Christian, when you look out of the cockpit, what reminds you of why this mission matters?
At the end of the day, what I tell myself whenever I get into that cockpit, whether it's back at the Aviation Brigade, doing a Medevac mission, and the priority is a patient, or it's here at Fort Rucker and stepping into the cockpit as an instructor with a student, it is critical that when you get in that cockpit, you are healthy, you are well studied and well rested and ready to execute the mission and respond to whatever comes, because our priority as Medevac and medicine is always the patient. And if you are not taking care of yourself, and if you are not prepared yourself, then you are doing the patient a disservice, and you will not execute your mission to your fullest capability. So your priority is always the patient, and you should prepare yourself as if you were going to go out and do that mission every time you fly.
Becca, when you care for a patient during the most difficult moments of their life, what reminds you why Army nursing is important?
I've always said one of the things that I love most about being an Army nurse is our patients. And that's what matters and why we're here, is that the patients, we have the best patients in the world. There are service members who are out there risking their lives doing what they do. The less than 1% of the U.S. population, volunteers to be in the military. And those are the people that we are caring for, as well as their family members who also give them the support, and our veterans. So just knowing who our patients are is what drives me and why I love it.
Thank you both for your answers. And I think that ties in very much why Army Aviation and Army Medicine are stronger together, because what we truly do does conserve the fighting strength. As we wrap up our aviation mini-series, I hope one message has come through loud and clear. Mission readiness isn't built by one person or profession, it's built by teams. Throughout this series, we've explored flight physicals, hearing conservation, mental health, myths, readiness, and today the incredible partnership between Army Aviation and Army Medicine. Whether you're in the cockpit, at the bedside, on the flight line, in the clinic, or supporting operations behind the scene, every role contributes to one shared mission: keeping our soldiers healthy, ready, and able to answer the call. I'd like to thank all of our guests who shared their experience and expertise throughout the series, and a special thank you to our pilot and chief nurse for helping us bring this conversation full circle. Most importantly, thank you to our listeners. We hope you've gained a greater appreciation for the people, the teamwork, and the dedication behind every successful mission. Remember, behind every flight is a team. Behind every mission is a commitment to excellence, and behind every soldier is a network of professionals working together to ensure they are ready when our nation calls. I'm Lieutenant Colonel Leah Steder, and this has been Lyster Health Talks. Thank you for joining us for our aviation mini-series. Until next time, take care of yourselves, take care of each other, and as always, stay healthy, stay ready, fly safe.
And that concludes our special Aviation Medicine mini-series here on Lyster Health Talks. Remember, total force readiness starts with you, and Lyster Army Health Clinic is always here to keep you mission ready. Thanks for listening. Stay healthy, Fort Rucker.